Welcome. My name is Corinne Waldow. I'm the Economic Development Director at the Boulder Chamber, and I'm welcoming you to this feedback session for the retail sector. I want to thank you for committing your time to this feedback session and to our Boulder County Chambers and Economic Development Agencies for their partnership in putting this event together. We want to continue the dialogue in the weeks ahead. We also want to thank Boulder County Public Health for hearing our community's interest in working hard to get our businesses open and our economy running again, but in a safe manner for our business owners, their workforce, and customers. We'll start today with some general information about the Safer at Home order, timeline, and safe workforce and workplace practices, and then move into specific required public protection steps for the retail industry. Please note that some of these practices are mandates from the Colorado Department of Public Health and Environment, and there's no possible adjustment. And others are Boulder County Public Health ones that they feel are critical. So it's likely there isn't a chance to change them, but it's okay to identify gaps, to ask questions, and to create dialogue on strategies for meeting each public health condition. Let's begin with the opening presentation by Lane Drager, the Community Mitigation Liaison at Boulder County Public Health.
Thank you, Corinne. Thank you all for taking time to join us. We appreciate your engagement, and we hope that this is a continued engagement and just a first step. Also, a real big thank you to all the chambers and the economic development folks for helping put this on, get this information out, and continuing to share information as we continue to move forward. What we're really wanting to focus on today is give you an update on where we're at, kind of the current status, talk about the timelines of as we move from the stay at home into the safer at home orders. We've developed some compliance checklists that are sector specific that hopefully will be tools to assist businesses in helping them comply. Talk about and hear from you. The bulk of what we want to do is that discussion on those challenges and any solutions and things that you would like to put forward. Really thinking about gaps in the guidance or any conflicts that come up. So again, that opportunity for you to ask questions and give us feedback today and ongoing. We want to really keep that door open. So just a small overview. This may not be an exhaustive list, but here's sectors that should be on this call, or ones that are certainly equivalent, very similar, unless you've been specifically called out in another sector, but this is who we're hoping to target today. So we've heard a lot of feedback, and we want to continue to get feedback and have that open dialogue as we continue to move forward. We know that our focus is the health of the community. We also know that the vitality of the business is part of that health of our community. We know that you also all care about safety for yourselves, your businesses, the patrons that you have. So really that is an important piece that we want to continue to work together on. This is one of hopefully many future opportunities to have a seat at the table and help us think through how we move into these next phases. It's critically important that we're successful because we do not want to have to put orders in place that reverse the direction that we're starting to go. We really want this to be step one of future steps that continue to ease some of the orders and give you more and more opportunity to have open business. We also understand that how important it is for you to have clarity on what the requirements are, how to implement them, and that's a critical piece of why we're having this meeting, and then the education sessions that we're going to have next week as all the guidance is finalized, all the documents are out there, and making sure everyone is ready, that when May 9th comes, that we're ready to move to that next phase. Some of the policies, the orders that have gone in place have just been across the board, stay at home. And now we're moving into policies that have a little bit more sector specific requirements. Actually, you can go back, Angel, to that previous slide. So we're gonna really kind of spend some time here outlining that process of how we're moving to those sector specific ones. And then this is one of the events that we're gonna have. We have those events next week, but again, that ongoing dialogue. Just wanna touch on some of the masks as you see that, and this will obviously be questions that come up we'll want to use that Q&A throughout our session, but just to proactively talk about, when we talk about masks, unless it's specifically called out as a surgical or medical grade mask, we're talking about a face covering, something that is covering your face, something that, there's guidance on CDC how to make them yourselves. There are drives to get masks, and people are making them in the community just to help and share and provide them. So we know that that's going to be a challenge for various sectors to find those kind of things, but we're not talking about respirators. We don't want businesses competing with our healthcare system, who needs a lot of that critical infrastructure and those supplies. So that's what we're talking about, masks, but we already recognize that's going to be a challenge for you. So not to save you from asking those questions, but as we have resources that link to people who are making masks locally, or how you want to start making your own masks, we will definitely provide those, but we recognize that's going to be a challenge. And again, our hope is that the more we work together and we can share consistent messaging and effectively implement these things, that will help build that public confidence that you have their safety, and certainly we have their safety in their best interest, and that we're making decisions that are not going to make us slide backwards and see spikes in our disease. So again, just to reflect on that timeline, we've been in this stay-at-home order for several weeks now, and Boulder County extended that because we really didn't have the testing infrastructure. We didn't have our surveillance and tracing infrastructure staffing wise, and certainly in the metro area had not seen the sustained disease suppression that's needed under those stay-at-home orders. So that really forced that extension through May 9th. But we are now building all that guidance to move to this safer at home model, which will go in effect on May 9th. So again, stay at home is still effective for those retail sectors. The one difference that was allowed this week and into next week is that curbside pickup and then delivery services. And that guidance we've disseminated, that's out on our site, and I believe the chamber has all that information as well. So certainly we can get into questions of how that's going or issues around that. But again, that is something that is happening right now. But again, May 9th is when we will move forward with opening up more of the businesses and more of the other sectors under the safer at home. This is still a long-term effort. Safer at home hopefully will continue to evolve if we are successful and we don't see spikes in disease outside of the spikes that we are anticipating because the current testing is not maximized. But hopefully that will continue to be successful and evolve. We will continue these ongoing dialogues and share as we move to next phases, and work with you to make sure that guidance is robust and everybody has it. But again, we're not expecting things to ever go back to pre-COVID, certainly before there is vaccine and effective immunity or other treatments within our communities. So that is a really far timeline to get to that point. I think we went back one. All right. So I think this is now where I'm going to transition over to Angel, and she'll kind of start to cover some of the pieces for safer at home for the retail. But these are the other sectors that we have been working with, similar to this webinar that we're doing for you, we've done for these other sectors.
Okay, great. Thank you, Lane. So as Lane said, I'm Angel Bond. I'm the retail liaison for the business team. And today I'm just going to talk a little bit about the retail industry and then the checklist that Boulder County has developed directly applicable to the retail industry. So in general, what is permitted? As Lane had mentioned, currently curbside pickup and delivery is available for retail, even if you weren't deemed critical prior. So now you should be able to set up curbside pickup and delivery, and that guideline is actually posted on the Boulder County website, and I'm sure that the Boulder Chamber has sent it out. Additionally, after on the start of May 9th, retail is able to be open with restrictions, and we'll go into what those restrictions are. But then also there's going to be increased frequency in cleaning expectations, and then also maintaining social distancing requirements. And I'm sure a lot of you have heard the term social distancing, so we really want to try to maximize that 6-foot distance between people to limit the spread of COVID-19. So additionally, what is permitted is to promote good hygiene and sanitation, and we'll talk about how to do that here in a little bit. And then also, all operations must adhere to both the general guidance, which applies to all businesses, and then also the specific retail guidance. And that checklist will be sent out after this presentation for you to be able to comment on. It's going to be a Google document that you can add your comments. And as Corinne said, we are looking for what gaps are there, and then what challenges are you going to have to implement that. We are following the Safer at Home order, so a lot of that is not negotiable, but we're open to ideas on how to implement it. So the compliance checklist, compliance with the Safer at Home order is mandatory, but the checklist is voluntary. So what we've tried to do is develop a resource for you all so that you can go through and make sure that you're adhering to each of the compliance issues outlined in Safer at Home. There will be a self-certification that you can use as a business, and it's supposed to be a compliance aid for you. Additionally, it's going to be a communication tool so that you can communicate with your customers that you have been through this Boulder County certification checklist. And we will have a poster to come that will be in both English and in Spanish that you can post in your establishment, showing that you have went through this checklist and you are complying with the Safer at Home orders. As far as enforcement goes, we are asking for voluntary compliance. We're going to assume that you're complying with the Safer at Home order. And if we do get a report from the public that you're not, we're going to inquire first and find out what exactly you're doing, and then focus on educating people. So we would like to be a partner in this and help you meet your compliance responsibilities. If there are issues, then we may ask for the checklist to show that it's been completed. And if it escalates and if we continually get comments about violations from the public, then we'll look to possibly orders to close or civil action. So I'm going to go over what the checklist covers in 3 different domains. So the first is going to be workplaces, so what you need to do as an employer. The other is going to be measures that you need to take to protect your employees. And the third is going to be what you need to take to protect your customers. So the first one, and this is not an exhaustive list of what's on the checklist, it's just kind of the highlights that pertain to the retail industry specifically. But we would like to see retailers establish curbside delivery. Even once open restrictions happen after May 9th, we would like to encourage businesses to continue that curbside because it does protect people to a greater extent. Once we're able to do open with restrictions, the establishments need to be at 50% capacity. And we will have a tool on our website that will help you calculate how many people you can have in your facility at any one time. We also are expecting businesses to sanitize frequently touched items such as door handles, payment systems. So as people use the stylus, we would like you to clean that off. Also baskets, shopping baskets and carts, depending on your establishment, what you have. So any frequently touched surfaces need to be regularly cleaned. Additionally, promoting contactless payment systems is highly encouraged. So if you have a website that you can have people order ahead of time, or if you can use any sort of Apple Pay or something like that where you don't actually have to touch anything, that's preferred. We do outline steps if you have to handle cash. And also what pertains to retail specifically is to restrict your return policy. Ensure that you're only accepting returns for things that can be sanitized to a certain level. So there's certain things that we're not able to sanitize for resale. So that would be important to restrict that and post in your establishment that you can't accept returns on particular items. What we need to do to protect the employees is to really maintain that social distancing and have them wear gloves and face coverings, provide frequent hand washing breaks, and then also require symptomatic employees to stay home. So there are links in the checklist for you to be able to do those screenings at the beginning of each shift, so that people are going through the symptomatic questionnaire if they have symptoms, and taking temperature checks at the beginning of their shifts. But we really do want employees to stay home if they're sick. That way they can not spread it to other people. Things that we would like to highlight that pertain to the customer. There are signage requirements that are included in the Safer at Home order, and we have linked in the checklist to the CDC tools so that you can just print off some of those signage requirements. But we want establishments to be able to mark spaces in the checkout lines to ensure that customers are maintaining 6 feet between customers as they're paying. Also, dedicated hours for high-risk customers. And by high risk, we're looking at older adults that are 65 years or older, people who are immunocompromised, pregnant women, people who also are caring for people who are vulnerable populations can be served during these hours as well. And then, as I mentioned earlier, the signage to promote social distancing and face coverings posted at different points throughout your establishment. There are signs that you can print off from CDC that will say stop, have you sneezed, have you coughed, basically going through that checklist as people enter into an establishment to just remind them not to come in if they have had any symptoms. And what we're looking for today is really, we want to listen to what your feedback is. And I know that's, that not all of you have had a chance to look at the checklist. So you'll be able to submit these answers to these questions. But we want to know what you think of the checklist as a tool. We want to know any compliance issues that your industry, that retail is having, specifically as it pertains to the checklist and the Safer at Home orders. Again, the compliance is mandatory, but we want to help be a partner in helping you succeed in complying with the order. Additionally, is there value in having a weekly working group meeting? As Corinne and Lane had mentioned, we're going to hold a training session on the retail industry next week, so we can go a little bit more in depth than what's required. But we'd like to hear from you. Is that going to be valuable to do that on an ongoing basis? I know that there's definitely need in the retail community just based on the number of people who have signed up for this. Additionally, what we want to know about the checklist is what modifications or additions should we include in this? We also want to know, like, what gaps do you see in the checklist? Have we not thought of particular ways that you encounter your customers? We also want to know areas that aren't covered by this checklist, and if it's valuable again, and then what else we need to incorporate into this checklist to make it a truly useful tool. So I know that you can enter your comments into the Q&A area, but what we also want to know is what challenges your industry is facing under the Safer at Home order, and what support does your industry need? So I know we have heard quite a bit that smaller businesses need help connecting with those PPE resources like masks and gloves and plexiglass. So we've heard that throughout these sessions that we're holding. So we just want to know what other support can either the Boulder Chamber or Boulder County Public Health provide for you in your industry. So is there value in, I mentioned this earlier before, but for the industry working group, we also want to hear if you would attend a weekly working group meeting on this. And then also, if we held those weekly working group meetings, what should we cover? So we could cover potentially best practices, what to do if your employees are sick, basically safety procedures, whatever would be useful for you and the gaps that you're seeing for retail. And also, if we have presenters come, like, who should we invite to those working group meetings? We'd like to hear about that. So this is an email and a call center. So the additional questions and suggestions can either be entered into the Q&A section of this, this presentation, this Zoom meeting, or else you can also email COVID violations@bouldercounty.org. And that COVID violations email is set up prior, so it's not exactly applicable to what we're asking you to use it for, but you can also call the call center, which is listed here, and that's open 8 a.m. to 6 p.m. Monday through Friday. And our team, our business liaison team, will respond to those comments and questions that you call into the call center. So again, next Tuesday at 3 p.m., we're having a training session, and I've included the shortened URL for you, but you can also just go to the Boulder Chamber, and those are listed for all of next Tuesday. All of the different sectors are listed. And I would encourage you to attend multiple if you have different aspects of your business that apply to different types of guidance. So for example, if you have an office setting, then I would encourage you to attend that, and also the retail, just because there's going to be slightly different items covered. So I don't know if you have any questions for us, Corinne.
All right, we do have some questions. Some of them were answered, and a couple people identified that personal services may also be something they need to attend. That session's at 4 o'clock today. If you need registration into that, I would register so we can get you the login information for the 4 o'clock session today. One question came in, will the social distancing be by square footage or something?
So we do have the square footage calculator. We will have a square footage calculator that you can link to from the checklist. But generally speaking, you want 6 feet between people. Best practice for retail establishments, or just for establishments in general, is to kind of do that square footage calculator on the front end and know what your maximum amount is, and then also post that on your door just to notify people when they're coming in, like what the limit's going to be. Another best practice is to have an employee perhaps at the front, just letting people know what's expected, and like reminding them to keep that 6-foot distance, and then also monitoring flow if it does become an issue, if like clustering of people does become an issue.
Great. If your store is small and we don't have aisles, do we still have to have signage for this?
So yes, you still do have to have signage, maybe not for one-way aisles because you don't have aisles, but you do need to encourage people to stay 6 feet apart and remind people good hygiene practices, like covering their mouth, wearing face coverings, not touching high or washing their hands after high touch areas.
And just to let everybody know that some of the resources that will be provided next week are the checklist, of course, but links to signs, whether they're the CDC signs or ones that we're creating locally, that you can just print out and put up, that will meet the needs of some of these orders and the requirements. So you don't all have to go home and type out signs. Those resources are available and will be provided. We've also gotten a couple questions now about returns and sanitizing clothing. Now, there's understanding of how to sanitize something that's hard or surface, but is there necessary steps to sanitize clothing?
Hey everybody,
so I don't know that.
Yeah, Angel, I got you. I got your back on this one. Hey everybody, this is Zach Swank. I work at Boulder County Public Health as well. Clothing is an interesting one, right? It's a lot of different materials, but the latest research that we've seen has shown that COVID can persist on clothing for up to 5 days. So, the best practice would be to, if someone tries that on, pull that item of clothing out of circulation for 5 days. Something else to note is that, the persistence of COVID on surfaces follows an exponential decrease. So, after the first day, it's going to go down by 50% of whatever, the amount of COVID that was on that piece of clothing, if there was any, and then 25%. And so it decreases at that rate. So best practice would be to keep it out of circulation for 5 days. Please recognize that this is going to be, changing guidance here, right? As it is, COVID's persistence on various surfaces is better understood and studied over time. But what we're seeing right now is 5 days.
And you can also, if launder or use sanitizing wipes on really any surface. But between those two, you're not going to have a lot of concern, assuming you're not putting those right back into circulation. So I think you'd be very covered where you have those different options. But yes, it will not persist, especially in a dry, arid environment outside of a host.
So the question then, we had two people ask, will a steamer speed up those days, or is that considered laundering?
I mean, high heat would inactivate a virus, but I think it's still in your best interest not to try and turn things around that quickly, unless there's some extenuating circumstance where this product is like a life safety kind of product. Otherwise, we wouldn't necessarily recommend you instantly try to get that back in another customer's hands. If you have very specific situations on that, please reach out to our team and we can try and sort through that.
Yeah, I agree with Lane, and I would caution against trusting a steamer. Certainly, if adequately used, that may be possible that it would eliminate the virus, but there's a lot of protocols that would need to be followed there. So the best thing would be to quarantine the clothing.
Okay, so we have the question we've had on every call, and I know you covered a little bit, but you might want to talk about people's concern to get enough disinfectant and PPE prior to the 9th.
Yeah, so I think those supplies are going to be even more strained as we move to this next phase, because you can imagine all the different businesses that are now going to want those same supplies. So I think our big messaging is where you're asked to have masks, do not try to go get respirators. That's not the requirement that's being asked of you, and it will put an even further strain on the healthcare system and those that really need those level of supplies. So for masks, again, the do-it-yourself masks, there's guidance that we have provided. CDC has directions on how those masks can be made. There are some groups that are doing mask drives and providing masks within the communities, but the demand is going to likely still be higher. It's really a face covering for when we're saying mask or face covering for a lot of these different industries outside of kind of healthcare systems and some of those other critical folks. Disinfectants, though, are going to still be a challenge. You can make your own solutions of bleach and water, and so there's guidance on how to do that. So it doesn't have to be buying Purell or things like that. But again, we will certainly provide any resources we identify to help people, but recognize that these are going to continue to be challenges. So, at some point, if you're not able to provide the infrastructure needed, that is a limiting factor on being open. You cannot continue to operate just because you don't have the needed supplies. So they are still going to be critical to the ongoing success of this phase and people to stay open.
Should also add that the city of Boulder is under a order that all customers, really anyone in a building needs to wear a mask. You can see that order on the city's website. Also, I can say that other communities in Boulder County, as well as Boulder County, are considering and looking at a similar requirement.
You just answered one of the other questions, which was, will masks be required for patrons and employees? And you said in your presentation that employees need to wear masks. And Zach just answered the piece about patrons. Also, can businesses, even if it's not an order within their city, request that people coming in wear masks and put signs up saying such?
Yes, they can.
Okay. There's a question about plexiglass. There's, in the presentation, talk about protective plexiglass. What does this need entail? Do we have to have a pass-through for credit cards? How big? What's required in the plexiglass area?
So, I mean, I think that what we're looking at with plexiglass is really just to have that barrier between the people, right? And I don't think that there's specific guidance in the Safer at Home on like the dimensions of the plexiglass or how far away the payment system needs to be. There is some recommendations in the checklist on how you should keep the payment system as far away from you as possible so that there's maximum distance between customers and employees who are working it. But I'm not sure as far as like specific guidance on plexiglass. I'm not sure if Lane or Zach, if you've heard anything else.
So I think that this isn't a mandate, just to be clear on the plexiglass. I think those are different options on how you can try to arrange your business to avoid that direct personal interactions with folks, especially around payments. So it helps create a physical barrier, which can knock down those droplets.
Lane, it is in CDPHE's
Just pull that
guidance. Yeah.
I don't see
So, for plexiglass, as Angel said, the intent is to create a physical barrier. So use your best judgment. Having a 3 inches of plexiglass down at the bottom of your counter, like sure you got plexiglass, but no, that doesn't count. Use your best judgment in terms of what would provide that best physical sort of infrastructure barrier at that critical point of interaction where you have your customer and your employee basically have to be less than 6 feet away from each other, and so you want to have that barrier between them.
And I know that one of the questions that came up is the access to plexiglass. So will that be included in the resources you provide? For everybody's knowledge, there's also going to be from the state of Colorado in the next couple of weeks a marketplace for certain products that are needed in these orders. But any additional advice on where to find plexiglass?
So I don't think we've been tracking that issue to date, but I know that we're getting together a list of providers that Zach, I think you said that it'll be available next week for masks and PPE and stuff like that. So I definitely think we can look to see what other plexiglass vendors are in there, but I don't know if that's something that the chamber would be better equipped to connect you with.
Okay, and there was just, I think at some point we're gonna need to make sure that in those checklists we say whether plexiglass is a mandate or not. Just make clarification in those checklists. There's a couple questions that are coming in via the chat. It's a little easier if you do it in the Q&A, but I will try to capture some of those. Can we sign for our customers that are using a credit card if we ask them permission? That would decrease a point of contact on iPads.
So I'm not sure as far as, I mean, I know that when you're doing online purchases, you don't necessarily have to have a signature, but that's not an area that we've looked into as far as signing for your customers.
Yeah, that's a great example of good feedback for us to look into. I would say, can't answer for the credit card companies and their requirements, but from a practicality matter, I certainly see the logic to that. But it would be good for us to do a bit of research on, see if we can find guidance on if that exposes you to any liability vis-a-vis your credit card processing. But I see the logic to it.
But there are some good practices. I mean, depending on if it's like signing with an actual pen, some businesses have set up, or some critical businesses have set up to where they have the clean pens in one can, and then the like the dirty pens in another. And so as people sign with the dirty or the clean pen, they can put it in a dirty pen, and then to clean all of those at once. So there are practical things that you can do to reduce the number of touches.
And we've had some people say that they can check with their credit card companies to see if signatures are necessary, and that might reduce some of the interaction. We do have a question about their accountability to police customers maintaining 6-foot distance in the space in front of bathrooms and or what is the responsibility of the company and the employees? And what, as a second part to this question, I got this via email, what tools can we provide sometimes our younger staff that are working in some of these facilities to tell them what they need to say to customers if they're not following some of the recommendations or requirements?
So as far as the Safer at Home order, it directly addresses signage to post to remind customers to stay 6 feet apart. And it also talks about having audio. So if you're in a larger establishment, that you can remind people through your audio system to stay 6 feet apart. Those were recommended. but they, I don't think we got guidance on enforcement of that, like at what point businesses should confront clients or customers. I don't know if Zach or Lane, you have suggestions on that.
Yeah, on the enforcement side, this is all a new thing for all of us, and we're all navigating uncharted territory here. You're not going to have, at this point, you're not going to have a police officer in your store watching to make sure that you are keeping your customers 6 feet apart. That's a level of detail, that we're not going to get to in enforcement. However, obviously, that is a practice that is required and needs to be followed. In addition to the suggestions that Angel mentioned, having the one-way aisles, or some sort of flow pattern around your facility, if your retail shop, if you don't have aisles, is one option. Continuing to just do curbside, is always available as an option as well. Limiting the number of customers in your store is already talked about. As far as, helping employees help customers maintain their distance. In addition to sort of the auditory loudspeaker announcement, if your shop has that capability. Another option would be, doing a little role playing with your employees, sort of so they can get practice, politely and respectfully communicating with customers that, hey, we need to maintain this distance. It's important to the safety of our other customers. That role play could really help.
And just in general, like the signage is really helpful. And then also the checklist recommends like decals to tell people where to stand. So I think that when you reinforce that with both visual and audio, then that could be effective.
Can somebody please answer the question about if this is City of Boulder, City of Longmont, Boulder County, just clarify to individuals what the perimeter of this order is.
The perimeter of.
There's question as to whether this is just City of Boulder, unincorporated, Boulder County. I would just clarify what this includes.
Sure.
So I don't know if you want to take it, Lane.
Yeah, I think I can get that. So if they're discussing this idea of safer at home, that is a statewide order. So that applies everywhere in Colorado unless there's some variance given to an area that's applied for to the state. And so all we're sharing is everything we've compiled for everywhere in Boulder County with all the guidance that we have. So it applies across the county. The confusion might have been, we shared that the City of Boulder has passed a local city ordinance requiring people to wear masks for all kind of indoor activities. There is discussion amongst the entire, I think, Denver metro area for a similar thing to happen countywide for Boulder County, as well as the Tri-County area, Jefferson County and City and County of Denver, City and County of Broomfield. So more to come on whether that becomes a Boulder County-wide piece. Those dialogues are still happening. So that was maybe the confusion. But as far as for the stuff we presented for retail, that applies everywhere in Boulder County.
Now, correct me if I'm wrong, wherever you're situated, the most restrictive policy is the one that they have to follow. So even if you're in Boulder County, not all of Boulder County requires masks. If you're in City of Boulder and that requires it, that's the policy you have to follow.
Yes, that's accurate. The stricter guidance is what you need to follow.
There's a question as to, we talked about flow of traffic. If this is a requirement to have arrows on the floor, especially if they have signage and it's a smaller store.
So I don't believe it's a requirement, but let me double check that before. I think it's guidance for best practices, but
the requirement is for flow through aisles. So if you don't have aisles, think like grocery store aisles, then I don't see how you could have a one-way flow if you don't have aisles.
Zach, you said you wanted to cover the UVC.
Yeah, so there was a question or a suggestion that one facility is looking into getting UV sterilization for clothes. And I just wanted to, that's something that Boulder County Public Health is looking at, as are hospitals, for, masks and other select PPE reuse. Anyone who's considering that, I would encourage them to contact us at COVID violations at bouldercounty.org. Our safety officer, Bill Hayes, has been reviewing those types of equipment and can help provide guidance on whether or not the particular equipment that you're looking at will actually do what you're hoping that it will do. So we're here as a resource for anyone who's looking at any sort of UV sterilization or other types of sterilization equipment to evaluate whether or not that's going to be suitable for your intended purpose.
Okay, so just a comment or a feedback or a question. There are a couple people that have indicated that in the final checklist, they would like to make sure it's clearly indicated what's mandated and what's recommended. Just putting those out there. Then let's see, do we have any more questions? Got a lot of people giving me feedback that they would like to attend weekly meetings, receive updates when they need them, education.
I see a comment here about, this being a moving goalpost, and, our earlier comment that we're going to be under, some form of safer at home for the foreseeable future. I understand the frustration and the challenge of a moving goalpost. The reality is that COVID is a highly contagious disease, and it's going to remain that way. We're putting different precautions in place to be able to control the spread of the disease, but no one thing is going to be entirely effective. And so we will continue to see a changing landscape of requirements as we learn more and as we understand how the practices we put in place are working. Obviously, the scenario we most want to avoid is backsliding and having an increase in cases and going back to a full stay-at-home order. We need everyone to follow and go beyond the safer at home orders to prevent that from happening. But just, it is, I want to reiterate, it is going to be a changing landscape of requirements. And, with folks' interest in continuing having these calls, I think it's a great way, channel of communication between, businesses and public health for, two-way feedback, but also to make sure everyone has the most up-to-date information.
All right, we're getting some great messages also on some additional companies locally that may be able to provide plexiglass panels. So we'll make sure we add those. Blaine Landreth with the City of Boulder has given some comments on some local ordinances as well as companies. I've also heard from some award and sign companies that carry plexiglass that are available to help in this time because they're not making as many awards. Let me see, are there any other questions? I think we've covered, should we be concerned about increases in theft, seeing as how everyone is wearing masks?
I don't know that we can comment on that. We certainly hope not.
Yeah.
And I'm putting in the chat the state retail guidance, and you will see that the second point under the work sites tab on the left indicates that protective plexiglass screens at checkout counters are required. I will put that link in the chat now.
Okay. Are there any other questions for Boulder County Public Health? Ooh. So the question is, will there be a better clarity on what is required, recommended best practices, and et cetera? And I believe that next week we're going to be providing in partnership with you the checklists that you'll show what's required and access to resources. Do you want to add anything to that?
So the way that the checklist is divided up is basically the safer at home requirements, and then we go into the requirements from Boulder County, and then at the bottom, and then below that we have best practices, and then below that we have resources. So I think that a lot of these questions about what's required and what is best practice will become clear once you look at the checklist that we'll send out. And if you have questions, and if it's not 100% clear when you're looking at the checklist, that's the type of feedback that we really want to hear. We want to make sure that we're using this as a great communication tool for you so that it's clear to you what is mandatory and what is just suggested and best practice. So that's kind of next steps is the training on it, which we'll do next week. So they'll be definitely going a little bit more into the weeds of what is required for safer at home, and then also Boulder County at our session next week.
Also, to clarify, the checklist is a compliance aid. It's a tool to help you comply with the state safer at home order that we'll be reverting to. So all of the requirements are in the safer at home order. Boulder County may have some additional requirements on top of that, and those will be in the checklist. But you're going to find, 95, 99% of what's required in the state safer at home order, and at that link that I included in the chat.
There's a question as whether or not we'll do a future session, or you'll do a future session geared toward hospitality and working in hotels, even though they've been able to operate in some capacity.
That's a great suggestion. We'll take a look at doing that.
So again, Zach sent out the guidance from the state with the link that talks about how they're requiring a mode of plexiglass under the 0.2.
Mm-hmm.
So it is required. Sorry, there's also questions coming in the chat, so it's a little harder.
So we got a question about the balance between reopening versus staying under a stay-at-home order for safety. It's a tough one for sure, and we need to the folks who are making these higher level policy decisions. The governor's office. Our executive director of Boulder County Public Health are tasked with, weighing, public safety and our livelihoods and economies, which also include public safety, right? We're starting to see, the impacts of, increasing domestic violence under a stay-at-home order, and increasing mental health issues, right? So there's public health consequences either way, and so we definitely hear the feedback that we're moving too fast, we're moving too slow, and I can understand the perspectives on both sides, but just ask everyone to remember that it's a balance of trying to protect public health safety, which means both a need to open up and a need to stay closed. As our public health director, Jeff Zayak, said, it's a no-win situation. And so, the guidance and the route that we all are taking together, is the best that we can think of. And like I said, it's going to evolve and it's going to change. And if we see negative trends developing, then we will take more corrective actions. If we see positive trends developing, then we'll take, a more looser approach.
We have a few more questions. Thank you, Zach. Are we on track to move to a safer at home phase on May 9th, or is that still up in the air?
At this point, it appears that we are on track, although, there's an asterisk there. We have not seen the final go decision on that. But at this point, Lane, I don't know if you have anything else you want to share there.
I think it's our intent is why we're having these meetings is we're moving forward with May 9th. The caveat is if our disease surveillance suddenly shows something radically different, that will be reflected in final decisions. But as of right now, that is where we're moving towards. But it is all based on what's happening with disease in our communities. So I think everything is always up for potential change. That being said, we're not planning for that change as of right now.
Okay, there's a question that as these orders become more, as we finalize things, will there be a website where it's updated, and how will retailers know that the information they're looking at now has changed?
That's a really good question and great feedback. It has been more clear under the stay-at-home order, where we could compare the orders, straight to each other. And if the state updates the safer at home order itself, then that will be, we'll be able to flag those differences, and we'll do our best to communicate them out, to attendees of these webinars and through the public health channels. However, fortunately, there is a robust set of resources available on the state's covid19.colorado.gov website. Not all of that we're necessarily going to be able to track to see, if it was different from one day to the next. But the orders we can definitely tell. So nonetheless, you raise a good point, and it's something that we will think on and see if we can come up with a good solution for.
And the checklists, the resources, tapes of these recordings, they're going to be centralized in several different locations, but on the Boulder County Public Health website, as well as we have a partnership of chambers and economic development in the cities across the county that try to disseminate the necessary information to our businesses as we get it from our partners at public health or workforce or so forth. So we'll do the best we can to also alert businesses. I know downtown Boulder's on this call, and City of Boulder, and Longmont Chamber and Longmont Economic Development. We're all trying to work together to try to get as much information and the right information out to our businesses and centralize the information. Someone asked if they're going to be doing some of the retail in the parking lot and not letting people inside, similar to curbside. Do they still need plexiglass?
So I believe if you look at the curbside guidance, we do talk about maintaining social distancing and cleaning payment systems after each transaction. So I would take a look at that checklist to see our guidance on curbside, because if you're operating out of the parking lot, that's essentially curbside. It's just that's your staging area is the parking lot. And
the follow-up email to this webinar, I have gone in and added the curbside checklist to that follow-up so that you have that in your hands. I think I'm just going to make this the last question. The last question is, do all of these things have to be in place by May 9th in order to open?
Yes.
Yes. So the guidance under Safer at Home, you need to be compliant with that before you can open and be operational.
Seeing as we don't have any more additional questions, I'm going to thank everybody for joining us on these calls, for asking these questions, for getting clarification, for identifying gaps. We want to thank all of our partners at the Chamber. We want to thank all the other chambers and economic development and cities for getting the information out to businesses so that we can continually communicate and have these conversations and make sure that we're preparing beforehand and not surprised when it comes to May 9th. Again, there's another session for retail, more of the education side, next Tuesday at 3 o'clock. You can register on the Boulder Chamber website. There's links on a lot of our partner sites to be able to register. And we'll continue to have these as weekly dialogues moving forward. And then lastly, I'd like to thank Boulder County Public Health for dedicating a lot of resources to make sure that they can listen to the businesses and to help get these resources out beforehand so that we can have these opportunities for feedback and questions. If you'll receive an email from me pretty soon with a recording of this video, links to stuff that were mentioned in this call, and then anything else that has come up along the way. Any questions that weren't answered, we'll try to get those answered and out as well. I hope everybody has a pleasant afternoon, and we hope to see you next week. Thank you.
Thank you.
Thank you.